ठीक है, just do that. Bye. Okay. ये ready होने दो, just scan. So this guy who is in his late teens, around 20, you can see he had a very severe hypoplasia, meaning this part of the jaw had not grown both horizontally and vertically, and so that was causing this kind of a deformity. I'm going to show you some more, and that's him right now. I'm going to tell you what was done for him. So we did what is called as a double distraction. We did distraction osteogenesis. Distraction osteogenesis is a technique wherein we have grown new bone in his upper jaw. So there is a cut that I did this way, and then we stretched the two half of the jaw together. So we've got bone deposition in these areas, which has basically brought the nose, the lip, and also the teeth forward, right? And that's increased his projection, and also the profile, right? So that's what is being done. So this is a very useful technique for especially patients who have hypoplasia, either because of cleft or because of some other growth issues, or sometimes even if it's because of an accident. We can grow the upper jaw without actually cutting the jaw and putting it forward with help of plates and screws. And it's very, very essential to do this, especially for kids who are in the growing age, because then this improves the speech of the patient also, which is a very, very important factor when the patient has cleft. So I'm going to show you the scan now. It's just loading, but we're going to show you the scan that was taken before and after, and I'll explain to you the improvement or the changes that has taken place. All right, so this is the first scan, and this was before, and then I'm going to go back to the normal view. We're going to close these two, and I'm going to make these bigger. Okay, so you can now see the two images, how there has been a huge improvement in the position of the jaw, and you can see that there is a gap that has been created, as I explained, which wasn't there in the before. So it also looks like as if something has been done to the lower jaw, because you see it's sticking out here and it's not, but actually nothing has been done on the lower jaw, only has been done in the upper jaw. I'm doing a comparison now, so we're going to move it at the same time, and here you see the big gap. So that's the amount of new bone that we've achieved. I'm going to turn the view now, and we're going to try and quantify that movement that we've achieved. So you can see here now, so this is the two teeth, there was no gap in between, and now it's the same cut section. So you can see that the sinus size has increased. There is an extra gap here, and I'm going to try and measure that for you. So this is about 14 millimeters in the top, at the base of the sinus, of the top of the root, and it's about probably 11 or so, a little lower down. So this means that that much millimeter of new bone we have created for him. Yeah, so between the teeth is the root level, it's more than here because of the shape of the upper jaw. But you can see the huge difference. Here there is nothing, and there's this all jaw, that's part of the nose and everything that's come up. And we can also move down further, and you can see And the metallic thing that you're seeing on the roof of the mouth, this is the distractor that we've placed. This is going to be there in his mouth for a couple of more months, sorry. And then consolidates, that will be removed. I'm going to show you a much more easier view now, orthopantomogram. And again here you can see, so very close up. So see there's no gap between these two teeth, and you see there's a gap now, and likewise there's no gap here, and there's a gap here, and there's a gap in this area, all across the upper jaw. So that's where we're doing the distraction. That's where the new bone is going to come in. That's where this treatment is way superior than the conventional orthognathic surgery, wherein the jaw is just cut and moved forward. And also when you do that kind of a conventional treatment, it very often adversely affects the speech of the patient. The speech doesn't improve, in fact it worsens. But with this kind of a treatment, the speech improves, the position of the teeth improve, the facial profile, the facial proportions improve, and also even the vertical and the horizontal height. More the horizontal, but to a certain extent the vertical height as well. Okay, आपको भी समझ में आ गया ना? That's the reason why I did this with you around. So I showed you the measurement. You're doing engineering, तो सब मालूम पड़ गया कितना मिलीमीटर है, 14.5 millimeters. Whatever measurement you saw, that is the new bone your body is going to grow. For your body to grow new bone, what you have to do? Not move that. Because when your hand breaks, they put plaster white, or it doesn't move. Immobilization makes the bone heal faster. So first we have created the bone now, when we turn, by distracting the callus, and then now we are waiting for that to consolidate. That's where we put that particular thing. तो वो टूटना नहीं चाहिए. और उस पर आप हेवी फूड खाओगे, हिलेगा, बोन फॉर्म नहीं होगा, डिले होगा, सब कुछ प्रॉब्लम है. तो समझ रहे हो ना क्या हुआ है? जॉ को हाफ स्लाइस करके आगे ले आए, और कितना आ गया है मैंने आपको स्कैन में दिखा दिया है, 15 मिलीमीटर, 11 मिलीमीटर, एक ही जॉ में ऊपर और नीचे, क्योंकि ये कर्व है. तो जब मूव होता है तो पूरा एक से नहीं मूव हो सकता ना, कर्व में ऐसा है ना, कर्वी शेप पे है, तो इसकी वजह से वो ऐसा है, कट भी ऑब्लिक है. द नेक्स्ट थिंग इज, नेक्स्ट टाइम क्या करेंगे? वी हैव ग्रोन न्यू बोन, बट वी हैव नॉट ग्रोन न्यू टीथ. So we have to put a teeth there in the place where the bone is there. So next time when you come, इसको निकालेंगे. I was telling your dad, we'll put teeth there, because teeth ज़रूरत है, तो क्या फ़ायदा, खाना भी तो है ना आपको. That's what will be the next time we can do. But if the bone is not well formed, then I will take more time. Others will do it next time. Understood? And the nasal base has also come forward, because cut is above the nasal base. So that's why that's come forward, and when we do the rhinoplasty, then the nasal profile and all will be nice. Okay, so as far as you are concerned, you have to eat healthy food. It's a little hard, but try to eat a lot of proteins, good food, because your body has to recuperate after a surgery, and also after, now it needs to consolidate the bone, and no chewing a lot, and that's it. Don't break the appliance, and if anything happens, अगर वो निकल गया तो immediately you have to let us know. You can't wait for that, with that removed, हिलेगा फिर. If it comes off, immediately you have to let us know. We'll tell you what to do. वापस बिठाना पड़ेगा उसको. ठीक है? Any other doubts you have? No doubts? Perfect. See you then. तो 3-4 महीने के बाद मिलेंगे.
एंड क्लीनिंग के लिए ब्रश अच्छे से यूज कर सकता हूँ.
करना है, क्लीन रखना है. मैं बोलने के लिए भूल गया. हाँ, जितना आप क्लीन कर सकते हो, और अगर काफ़ी क्लीनिंग के लिए मुश्किल है तो एक हफ्ते के बाद लोकल डेंटिस्ट को जाके क्लीन करा सकते हो आप.
अपर वाले टिप में जो लगाया है ना, ब्रश घुमा सकते हैं.
हाँ, हर जगह घुमा सकते हो आप ब्रश. ठीक है ना? और फिर भी अगर डिफिकल्टी हो तो फिर लोकल दिखा के प्रोफेशनल क्लीन करा लो. ईजी कर लेते हो 2 मिनट में. बट कीप इट क्लीन. बट ज़्यादा क्लीन करने से वो निकलना नहीं चाहिए, इसीलिए आप ही करो. इट शुड नॉट कम ऑफ. उनको भी होगा ये क्या है. सो देयरफॉर जस्ट कीप इट सेफ. और नेक्स्ट थिंग, स्कैन निकालना है आपको. मे बी 2 months लेटर फॉलोअप नंबर में भेजो आप स्कैन को, उनको बताएंगे ये सेम. और
जो स्कैन
निकाल देंगे, आपको बता देंगे. ऑलरेडी आपको डिस्चार्ज में मिल जाएगा. विल गिव यू द डिटेल्स, और वो सेंड करो. उसके बाद नेक्स्ट, अभी अप्रॉक्सीमेट डेट तो मिल जाएगा, बट फिर भी कंफर्म एक बात हो जाए. कभी कभार स्कैन में अच्छा बोन डेपोजिट नहीं हुआ तो हम विल टेक एक्स्ट्रा 1 month ऐसा.
राइट.
एंड देन इफ हिज सेमिस्टर इज देयर, छुट्टी कुछ उसको मिल रहा है तो दैट ऑल्सो वी कैन वेट, ताकि स्टडीज ऑल्सो डजंट गेट अफेक्टेड बिग टाइम। ठीक है,
ठीक है।
चलो बाय।
थैंक यू।